We're now going to cover intercostal arteries. Our objectives: identify the intercostal arteries, including their origin, course, and anastomoses. So here we have an intercostal artery in this section of the thoracic wall. Now let's follow and see how blood is going to get to this intercostal artery. And so in this picture is a lateral view on the left side of the thoracic wall. And the intercostal arteries that we'll discuss segmentally supply tissue within intercostal spaces and overlying skin. In yellow, there is the sternum, and then in orange are the costal cartilages, which articulate with the ribs and which articulate with the thoracic vertebrae. And so there is some orientation. Then in red are the intercostal arteries. And now all we're seeing are the intercostal arteries. And what we see is that there are anterior intercostal arteries that have been cut, so you only see a trunk of them, but if you look at the bottom, you'll see the entire thing. And then we have posterior intercostal arteries. Again, you see part of it, but they're cut to make the picture less confusing. But at the bottom, you can see the length of this posterior intercostal arteries. So let's talk about posterior intercostal arteries first. Notice that they segmentally come off of this aorta, which the aorta is a continuation of where the blood comes from the left ventricle. You have the aortic arch, and then it courses all the way down the back of the thoracic wall, pierces the diaphragm, and becomes the abdominal aorta. And so segmentally coming off the aorta are these posterior intercostal arteries that arise from every segmental intercostal space and fill that area. So all the way down. And now you can see even at the bottom all the length of these posterior intercostal arteries. Now we also have anterior intercostal arteries that segmentally, anterior intercostal arteries. Now these segmentally come off of this internal thoracic artery. It parallels the internal thoracic vein. They're basically in the same connective tissue sheath. And this internal thoracic artery courses like suspenders on the internal surface and lateral to the sternum from top to bottom in that fashion. And off this internal thoracic artery at every segmental level is an anterior intercostal artery. And you see then they're all cut at the top, but at the bottom you can see the length of the direction of these anterior intercostal arteries. So I've only shown the left side. This occurs the same way on the right side. The right posterior intercostal arteries are a little bit longer because the aorta is slightly to the left, but you have a left and a right internal thoracic artery that give off these anterior intercostals. Now, intercostal arteries form an anastomosis. What is an anastomosis? A connection. So you see these two red arrows showing an anterior and a posterior intercostal artery, and you see how they come together. They form these anastomotic connections where this can form collateral circulation. So intercostal arteries in a nutshell are as follows. Intercostal arteries are paired. You have posterior intercostal arteries that arise segmentally from the aorta and fill each of the intercostal spaces, and you have anterior intercostal arteries that arise segmentally from the internal thoracic arteries, and they fill the anterior intercostal spaces. And folks, here's internal costal arteries in a nutshell.